Diesel and antiseptic smell nothing alike, but exhaustion smells the same in both places. Stale coffee, damp wool, and the particular sourness of a body running on cortisol and stubbornness. Kezia Adler knew this the way she knew how to read a pulse without a monitor. She'd learned the smell in a field surgical unit outside Kandahar, and she carried it with her now into the fluorescent purgatory of Foothills Medical Center's emergency department in Calgary, where she was, according to the charge board, the float. The float, not a nurse, not a colleague. The float, Reinhold, the charge nurse, whose voice had the precise texture of gravel poured slowly into a tin bucket, had made this clear within the first 4 minutes of Kezia's shift. You're covering for Odaya today. Beds 2 through 7. OBS and assists only. Don't touch the medication cart. Don't initiate any procedure. If a patient asks you something clinical, you find one of my nurses. Reinhold hadn't looked up from the scheduling screen. Her reading glasses sat at the very end of her nose, performing a kind of permanent skepticism. Understood? Understood, Kezia said. She understood perfectly. She was a ghost with a stethoscope. She was the person who answered call lights and changed linens and handed basins to people who needed to vomit. She was the body that plugged the gap while the real nurses did the real work. She was fine with that. She tied her hair back in the break room, standing at the sink, staring at her own reflection in the way that doesn't involve actually looking. 34 years old. The skin under her eyes was the color of old bruises. There were 2 faint lines at the corners of her mouth that hadn't been there 3 years ago. She looked like a person who had stopped sleeping at some point and never quite remembered how to start again. Just afloat, she told herself. Her mantra, her anchor. Just afloat, you show up, you do the small things, you go home, you are safe in the shallow end. She pulled on a pair of gloves and walked out onto the floor. The ER at 10 in the morning was loud in the specific, layered way of emergency departments everywhere. The electronic percussion of competing monitors, the low register of a man somewhere in Bay 5 who'd been groaning the same note for the past 20 minutes, the chirp of a pager, the squeak of rubber soles on waxed linoleum. A nurse named Thibault was arguing in rapid Quebecois French into a phone receiver at the station, one hand pressed flat against her ear as though she could force the argument to resolve faster. 2 paramedics from EMS were offloading a woman from a stretcher, talking over each other in the shorthand of people who've worked together for years. Kezia moved through it the way she always moved through it now. Quietly, efficiently, taking up as little space as possible. Bay 3 had a 17-year-old with a suspected concussion whose mother kept asking Kezia if she was sure the CT was necessary. Bay 6 had an older man, Duplessis, who needed his dressings changed on a leg ulcer and who called her sweetheart twice and then apologized and then called her dear instead, which was close enough to an improvement. Bay 2 had a woman in her 50s, presenting with chest tightness, who kept insisting it was her acid reflux until the ECG said otherwise. Kezia did not interpret the ECG aloud. She flagged Dr. Navarro, the attending. That was the job. She was restocking the supply trolley outside Bay 4 around 11:30 when she heard Reinhold's voice pitch upward. Not toward anger, but toward something closer to alarm, which was different and rarer and worse. What do you mean they're coming here? We're not designated. We don't have a trauma surgeon on until 1400. Kezia stilled. They can't land in the ambulance bay. There are units parked. She set down the stack of catheter packaging in her hands. Very carefully, very precisely. How many incoming? The question wasn't fear. It was recognition. The word incoming had a different weight depending on who said it and where. In this context, it meant helicopters, and the specific quality of Reinholdt's panic meant these were not the red and white air ambulances that occasionally touched down on the hospital roof, making their light, high-pitched clatter. Kezia knew what a military rotary wing sounded like before she heard it. She heard it 11 seconds later. It wasn't a sound so much as a physical event. A low, concussive thudding that moved through the floor first, then the walls, then the center of her chest, like a second heartbeat asserting itself. The overhead lights flickered once. The patient in Bay 5 stopped groaning. Everything paused the way things pause just before they don't. One aircraft. Then, overlapping, a second, CH-146 Griffins. She knew the sound the way she knew her own name. Kezia backed against the wall beside the supply trolley and pressed her hands flat against the cool plaster behind her. Her fingers had gone numb. She pressed them harder against the wall to feel something solid and real. Not here. Not now. You are a float nurse in Calgary. You have been a float nurse for 2 years and 3 months. You are safe in the shallow end. The radio at the charge desk crackled. Then a voice that sounded like it was transmitting from somewhere very far away and very fast said 2 words. Her ears caught trauma and stabilized, and then static. And then the ambulance bay doors blew open as though something enormous had exhaled through them. They came in through the wide bay in tactical formation, which is to say they were not running, but they were moving with the kind of controlled velocity that made the distinction irrelevant. 4 of them in CADPAT, the pixelated green-brown pattern of the Canadian Armed Forces, with plate carriers and comm gear and dust from a place that was not Calgary, not close to Calgary, the kind of dust that takes weeks and specific geography to accumulate. They were carrying a litter between them. Trauma bay, the lead operator said. His voice was a command, not a request. He was built like the kind of man who doesn't fit through doors at his natural pace and has learned to account for this. There was a patch on his right shoulder, subdued, that Kezia recognized without wanting to. His name tape read Brodar. Dr. Navarro stepped forward, already pulling on gloves, already in the mode. What have we got? Sucking chest wound, left side. Brodor had the patient on the nearest flat surface, not the trauma bay, the outer floor, before anyone finished a sentence. Improvised seal on site, 14 minutes ago. 360 tourniquet on the right femur, mid-thigh. He's been in and out for the last 6 minutes, Navarro said. 6 hours. Brodor's voice didn't change. Closest level 1 with a cleared pad was here. There were things Kezia could see from the wall without moving closer. The chest seal, improvised, taped with what looked like the wrapper from an IV bag, had partially peeled. The soldier's lips were faintly blue. His trachea was wrong. Not dramatically, not yet, but slightly, subtly wrong, in the way that means the clock had already started. Tension pneumothorax, building. The seal was holding some of the pressure, but not enough. He had maybe 4 or 5 minutes of useful consciousness left in the body, possibly less. Navarro moved fast and correctly. I need a chest tube tray. Someone get me a chest tube tray. Thibault was already moving. Reinholdt appeared behind the desk, her face the color of old paper. Page thoracic. Navarro called over his shoulder to no one specifically. Thoracic is at Rocky View until 1400, someone said. Navarro's hands were moving over the patient's chest, assessing. He was good. Kezia knew he was good. She had watched him work for 2 weeks across various floating shifts, and he was competent and careful, and she had no criticism of him, except he had not seen this specific configuration of injuries in this specific sequence. She knew, with a kind of flat certainty that had nothing to do with arrogance and everything to do with having seen it 3 times in the dark in places she refused to name, that he was about to go for the chest tube directly and skip the needle decompression, because in a hospital with all the time in the world, the chest tube was the right call. But this man did not have all the time in the world, and in the next 30 seconds, the pressure building in that pleural space was going to. Broder's head came up. He wasn't looking at Navarro. He was scanning the room the way soldiers scan rooms, the habit so deep it survived the removal of the uniform. He was looking for something specific. "Where's Alley Cat?" he said. The room did not understand the question. "Alley Cat." He said it again, louder, his voice cutting across the noise. "I need Alley Cat." Dispatch said her hospital registration came back to this facility. "Where is she?" Reinhold. "Sir, I need you to stand back and let our team. I'm not asking for permission." Broder's voice was not raised. It didn't need to be. "I am asking for a specific medic who I know is in this building, and I am asking because the man on that floor has got about 3 minutes before we lose him. And I have worked with Alley Cat in 2 countries and 4 provinces. And right now, she is the best option in this room. So where?" The soldier on the floor made a sound. Not a groan, not a gasp. More like a door closing on a hinge that hadn't been oiled in a long time. The chest seal crackled and partially detached. Kezia's hands stopped being numb. She did not make a decision, exactly. The body made the decision, and the mind caught up half a second later, the way it always had. She pushed off the wall. Her rubber-soled shoes didn't squeak. She walked through the gap between 2 of the operators and crouched down beside the patient, and she did not look at Brodeur, and she did not look at Reinhold, and she did not look at anyone except the man in front of her, whose name tape read, "Uwelt." "I need a 14-gauge angiocath," she said. Her voice was completely flat, not calm, flat. The difference matters. "Second intercostal, mid-clavicular, right now." Nobody moved for 1 full second. "I am a float nurse," Reinhold started. "She is not authorized. Thibault." Kezia did not raise her voice. She said the name the way a scalpel makes an incision. Clean, specific, without hesitation. "The angiocath. Please." Thibault looked at Reinhold. Reinhold's mouth opened. The patient made the closing door sound again, worse this time. Thibault got the angiocath. Kezia had already found the second intercostal space with her fingers, counting down from the clavicle, feeling for the superior edge of the 3rd rib, the landmark the way a blind person reads Braille. Ouellet's chest was rigid with muscle and the particular tension of a body fighting itself. His skin was cold and clammy and slightly gray around the mouth. "Hold his shoulders," she said. "Both of them. Don't let him arch." Brodeur and the operator beside him were already in position before she finished the sentence. She drove the needle in. The pop of entry is a specific sensation, a resistance, and then a sudden give, like pressing a thumb through wet cardboard. And then the hiss, the beautiful, urgent hiss of trapped air finding its way out of the space it had been crushing the lung from, venting through the catheter needle in a rush of pressure, equalizing. Pink-tinged, fast, Ouellet's trachea moved, slightly, back towards center. "Sats?" she said. 86. Someone said from behind her. 88. Climbing. He still needs the tube. She was already withdrawing the needle, leaving the catheter in place as the temporary port. She held her right hand open behind her without looking. Chest tube tray, scalpel. 36 French, and I need someone to draw up lidocaine. 50 mils if you have it. I'll take whatever you have if you don't." Dr. Navarro, who had not said a word for the past 90 seconds, crouched down on the opposite side of the patient. He said nothing at first. Then, fifth intercostal, anterior to mid-axillary. "Yes," Kezia said. It was not a question, it was a confirmation. He was orienting himself. She felt the tray land on the floor beside her left hand. The lidocaine arrived in a drawn syringe, and she infiltrated the site in a row of tiny blebs along the incision line, knowing it wouldn't fully anesthetize, but knowing also that Wellet was semi-conscious at best, and that the alternative to an imperfect block was no block at all. She waited 45 seconds. In the field, she would not have waited. In a hospital, she could afford 45 seconds. She made the incision. Blood welled up dark and immediate. She dropped the scalpel, picked up the Kelly clamps, and worked the incision open with her fingers and the tip of the clamp simultaneously. The blunt dissection technique, ugly to watch, effective to use. The kind of thing that looks like violence from a distance and looks like precision from close up. She swept her gloved finger through the opening to clear the space, feeling the slick resistance of pleural tissue, the hot rush of decompressing fluid. Tube. Navarro placed it in her palm. She clamped the end, advanced the tip through the incision with the forceps, rotated it posterior and superior the way you needed to drain properly, and fed it in. Dark blood moved through the tubing immediately. Not the pink froth of air alone, but the darker, heavier flood of hemothorax clearing. Blood that had been accumulating in the chest cavity and compressing the heart from the wrong direction. The Pleurovac unit, someone had set it up, and she hadn't even clocked who, began to cycle. "Connect him," she said, and stepped back. She stood up too fast and caught herself on the edge of the gurney someone had wheeled over. Her left hand gripped the metal rail, and she stood there for a moment. Just a moment, letting her vision stop doing what it was doing. The lights were very bright. The room smelled like the inside of an aircraft she had spent a long time trying to forget. "Rate is stabilizing," Thibault said from the monitor. 78. 81. He needs ore. Kezia looked at Navarro. "The leg tourniquet has been on for 6 hours. He's going to need vascular, possibly compartment fasciotomies, and he's going to be acidotic." She said this quietly, just to Navarro, the way you brief someone at a handoff. Navarro was looking at her with an expression she recognized but couldn't categorize right now. He said, "I'll get him upstairs." Then he was in motion, and the nurses were in motion, and Wellet was on the gurney and rolling, and the operators were flanking the gurney in that way they had, covering the egress, watching the hallway, making sure of things that didn't need to be made sure of in a hospital in Calgary, but that the training didn't know how to stop. Kezia stood in the middle of the open floor. Her gloves were soaked. The front of her scrubs had caught the spray from the tube insertion. She looked like the survivor of something. Reinhold stood at the charge desk. She was holding a clipboard to her chest the way people hold things when they need something to hold. She was looking at Kezia. The rest of the ER staff was looking at Kezia. Nobody said anything. Kezia pulled off her gloves, turning them inside out over each other, the way she'd been taught in nursing school, the way she'd done 1,000 times in places where the sharps bin was a cardboard box and the running water was a privilege. She walked toward the utility room at the end of the corridor. She needed to wash her hands. The utility room in Foothills ER was small and unglamorous, smelling of industrial cleaner, and slightly of mold behind the pipe fitting that nobody had gotten around to fixing. There was a deep steel sink and a soap dispenser that took 4 pumps before it gave you a meaningful amount of soap. The paper towels were brown and scratchy. Kezia turned the water on as hot as it would go and stood under it and scrubbed. She had not been back. That was the agreement she had made with herself. 2 years, 3 months. Float work in Calgary, 6-month contract at a clinic in Saskatoon. Before that, 1 miserable winter in Thunder Bay that she didn't like to think about. Keep moving. Stay shallow. Don't let anything get its hooks into you. She had been a combat medic with the Canadian Special Operations Forces Command for 6 years. She had been deployed to Mali, Latvia, and 2 places she still wasn't allowed to name to most people. She had inserted chest tubes in vehicles moving at 60 kilometers an hour. She had intubated a man using a headlamp while someone else returned fire 6 meters to her left. She had held a tourniquet on a femoral bleed with her hands for 19 minutes, while a helicopter that was never going to be fast enough was being fast enough. She had also, at some point, stopped being able to sleep for more than 3 hours at a stretch, and started leaving parties without saying goodbye, and found herself standing in parking lots, sometimes with no memory of deciding to go to the parking lot. She had put in her papers at 32 and told herself it was a choice. The door opened behind her. She knew the weight of those boots. She did not turn around. "Dispatch flagged your nursing license registration," Brodeur said. He was using his regular voice now, not the command voice from the ER, but the one she remembered from briefings, lower, more careful. He was a careful man underneath everything else. She had always known that about him. Cross-referenced against the facility manifest. "I knew you were here before we landed. How is he?" "Upstairs. They're prepping." A pause. "You know how he is. You bought him the time." Kezia kept scrubbing. The water was very hot. She was going to have no skin left on her hands if she kept this up, which was not the worst trade she'd ever considered. "You shouldn't have used my call sign in there," she said. "I needed the room to understand who they were dealing with." The room was dealing with a float nurse from the agency pool. That was working fine. The man on the floor would disagree. She turned off the tap. She stood with her wet hands over the drain, watching the last of the pink water spiral down. Someone had brought in a piece of the world she'd exiled herself from and left it on the floor of her ER, and now she couldn't put it back. "I'm not Alley Cat anymore, Brodeur," she said. "I haven't been for 2 years. You can call yourself whatever you want." He wasn't being dismissive. He was, she knew, being factual. "But I watched you read that tracheal deviation from 15 meters in a fluorescent lit room, and you were already calculating the intercostal space before you crossed the floor. You can change the name. The training doesn't update itself." She turned around. Brodeur looked exactly the same as he had looked the last time she'd seen him, which was the problem with men like him. They didn't look like they'd accumulated anything. She knew that was an illusion. She knew what he carried. She just couldn't see it from the outside. He had something in his hand, a small patch. Subdued colors, the maple leaf barely visible against the dark background, and below it the small stylized silhouette that had been their unit marker. He set it on the edge of the sink next to the soap dispenser. "Willette," he said. "He's been asking for you since Kabul. Not by name, by call sign. He said if he ever met Alley Cat, he was going to say thank you." He paused. "He got shot leaving the airport. He's going to make it." She stared at the patch. "We're wheels up in 3 hours, Brodeur said. "If you want to go back to floating, nobody's stopping you. You've got your reasons." I know you've got your reasons. He put one hand briefly on the doorframe, a gesture that wasn't quite a farewell and wasn't quite something else either. But muscle memory doesn't retire, Adler. It just waits. The door swung shut. Kezia stood in the utility room for a long time. The water dripped from the tap. She hadn't quite closed all the way. Tap, tap, tap. A slow, irregular rhythm, like someone knocking at a door they weren't sure would be answered. She thought about Owellet. She thought about the 6 hours between whatever had happened to him and the moment he'd arrived on her floor, and the 14 minutes between the improvised seal and the needle, and the 45 seconds of lidocaine she'd allowed herself because she was in a hospital and she could. She thought about the way Broder's team had moved through the ER, the controlled, frightening economy of people who have learned that a second of hesitation is a currency you spend once. She thought about sleeping 3 hours at a time. She thought about parking lots. She thought about the look on Thibault's face when she'd called her name. Not subordination, not resentment. Just the quick, clean response of a person recognizing someone who knows exactly what they're doing. Reinhold had said, "You are not authorized." The man on the floor had been alive to disagree. Kezia picked up the patch. The fabric was stiff and slightly gritty with the dust of somewhere specific. She turned it over in her fingers once, put it in the pocket of her scrubs. She smoothed the front of her ruined scrubs down with both hands, straightened her back, opened the utility room door. The hallway was bright and ordinary. The monitor in Bay 5 was beeping its slow, reliable rhythm. Somewhere down the corridor, a child was crying. Not the sharp, panicked crying of pain, but the tired, winding down crying of a kid who had been scared and was now mostly just exhausted. An orderly was pushing an empty wheelchair toward admitting. Thibault was writing something at the station, her pen moving quickly, her head down. Reinhold was waiting. She had the look of someone who had prepared several things to say and was trying to decide which one to begin with. Her clipboard was still in her hands. "Administration is going to want a full incident report," Reinhold said. "Dr. Navarro will want to debrief. There's going to be questions about scope of practice and—" "Yes," Kezia said. "I know." She stopped at the supply trolley she'd abandoned 40 minutes ago and looked at what she'd been stocking before the world had arrived through the ambulance bay doors. "I'll write the report on my break." Reinhold looked at her. Something moved behind her eyes that Kezia didn't have a name for yet. "Bay 4 needs obs," Reinhold said, finally. Her voice was slightly different, not warmer, just different in a way that was hard to define. "Patient in 7 is asking about discharge paperwork." "I'll get to them," Kezia said. She picked up the supply trolley and walked it back toward Bay 7, her shoes quiet on the floor, the patch sitting in her left pocket, small, as stiff and real. She was still the float. That was still the job today. But the hum of the fluorescent lights sounded, for the first time in a long time, like just a hum.